So this is essential exercises for breast cancer survivors, part 2, or the more advanced version. So you've already completed level 1 at this time. Do not skip level 1 and go right to level 2. And here is the reason why. If you are trying to prevent lymphedema, which most people are, and you overtrain, you overtax your system, and all of a sudden your arm blows up, you're going to have no way of knowing what you did, what was too much. But if you start and progress slowly with a few repetitions, and then a few more, and then a few more, and then gradually add resistance, then at whatever point you experience any swelling, you could say, oh, you know what, today's the day I went from 5 pounds to 8 pounds, and back off to what had worked. Of course, you're still going to want to go to your doctor and make sure that you get permission to continue to work out. They may also fit you with a compression sleeve, which helps to minimize the side effects of lymphedema. So if you're just getting started and you've tuned in or started watching this video, make sure you go back and do level 1 first. Leanie, you had no problems, you got through it, piece of cake. We have good range of motion now. That is kind of a prerequisite for doing level 2. We're going to get a little more advanced now. Not only are we adding resistance, but we're going to do some more advanced core work. So you're going to really feel those abdominal muscles come to life. It's also going to help you continue to work on strengthening your back and minimizing some of that back pain you have. You ready to roll? We're going to begin. Let me show you first. This is called a lat pull down. Now, for anybody who's had a lat flap reconstruction, just skip this exercise. Just as I explained previously, if you've had an abdominal tram, half of your muscle is still here and active, so technically you could do a crunch, but the other half is in your breast now. And so when you're doing a crunch, these muscles are contracting. Well, same thing if you've had a lat flap. The one side is still working normally, but the other side, when you do a lat pull down, is contracting in your breast. So it doesn't make any sense to do this exercise, or better yet, if you've had 2 lat flaps, then basically you're working both of your breasts in essence. So I know it seems kind of ridiculous, but it is true, because the mind-body connection is still there. Neurologically, your brain doesn't know that those muscles are not where they're supposed to be because they're still attached. Okay? All right. So you can go to any sporting goods store and get yourself a band. Very important that it has handles on it. The last thing anybody who is at risk for upper extremity lymphedema wants to do is grab a band in which they wrap it around their hand, as that will restrict the flow of lymphatic fluid and can increase your risk of lymphedema. So I'm actually going to give you a back view of this so that you can see what we're doing. This is good and bad. It reinforces the band, but it's also a bit of a nuisance. So what I'm going to do is I'm going to hold on either side, and for this exercise you will not use the handles, but I'm not going to wrap it around my hands. I'm just going to get a good grip on it. So excuse my back, but I'm going to begin with my arms overhead, and first I'm going to gently pull out, creating tension. Then I'm going to pull down, squeezing my shoulder blades together. Then I'm going to push out gently and back together. So one more time, I create a little tension pulling out. I pull down, squeeze my shoulder blades together, tension out, and then back to neutral. Really important when you're doing this to make sure you're keeping what we call a neutral pelvis, and that means it's not excessively arched, nor is it excessively flattened. So you may find that you're better off with 1 foot forward as opposed to how I stood. Okay, so why don't you go ahead and face. There you go. All right, so let's go ahead and put 1 foot forward just to give you some stability. All right, so just very gently pull outward. Now bend your elbows, let them bend. It's going behind you. Just keep those arms perpendicular. There you go. Now push outward again a little bit, looking good, and straight up. Okay, so here we go. Pull out. You're pulling right through here. Here's your lats. Bend those elbows. Keep your wrists stiff as a board. This is really tiring, isn't it? How about if we do 2 more? Squeeze the shoulder blades together. Exhale. Pinch, pinch, pinch. And really important to keep your wrists stiff. Good. 1 more. Good one. Just like that. Straight up. Last one. Take it out. Pinch those shoulder blades together. Exhale. And let them back. Okay. For just beginning with resistance, even though this seems like not much. Now, this is a green band, so tension typically begins with yellow, then green, then red, then blue, then purple. Because you are working large muscle groups, I think that the green is a decent place to start. But you were also an active person before your surgery. If somebody is elderly or much more sedentary, then they may want to start with a yellow band. We just did 4 reps today, but you can do 5 or 6 to start with. Then you'll add 7 reps, 8 reps, making sure there's no swelling, doing that pitting test, and progressing week by week. All right, the next thing we're going to do, we're going to combine core, balance, and we're going to go back to stretching your chest. So let me show you the exercise first. Watch out for the chair. We're going to use that in a minute. So this is a 65 centimeter ball, and when you go to the store and buy these, you'll find that they come in different heights once they're blown up. So I have a smaller version and a taller one. You want to blow it up so that it's nice and taut. If it's too squishy, it's going to make it very difficult to do the exercises. If you've had an abdominal tram, I would not do this particular exercise without supervision, as you're going to be very unstable. And of course this doesn't apply to you, but you run a risk of injury. And if you've had a bilateral abdominal tram, it's virtually impossible to get on and off this without having to compromise something. So you're going to begin by sitting on the ball, and I'm going to roll forward this way, if you will. If you can just stand here. And I'm going to go forward until my head is on the ball. And the key here is to keep my hips up in a bridge or a plank. Both of my thighs are parallel. You're going to start with your arms here, and you're going to let them come out. Feel that big stretch. You've got good range of motion now. You're going to pull from your armpits, just like that. Now I'm actually giving you weights today, but I want you to get the form first. And we're going to go straight from that exercise to the serratus reach now on the ball. Now getting off of here, I have good strong abs. I can roll myself up. But if you haven't done this before, you'll find yourself down here not knowing how to get up. Simply drop down to the floor and then work your way up safely. So Leanie, come on and let me help you on here. So go ahead and sit. All right, and then slowly just roll yourself forward. Perfect. All right, hips up. All right, just stabilize yourself. Let me get the weights. Now we're beginning with 2-pound weights, which sound like nothing, but when you've done nothing up to this point, we're going to start and progress slowly. Always start with the weights at your chest and then raise them upward. Don't ever start with your arms out at the side, as that's where you have a higher risk of shoulder injury. So arms straight up, right over your chest. Now inhale as you come out. All the while you're keeping those abs rigid tight. A little bend in the elbow, round like you're hugging a barrel. Pull from your armpits, exhale up. Good, keep it right over your chest. Inhale, so you're getting a nice stretch here, stretching through that scar tissue, stretching out that round shoulder syndrome, but also strengthening the chest muscles simultaneously. Every time you come up, you're tensing these muscles. Squeeze, let's just do 2 more. She's also working her core muscles by keeping herself stable on the ball. Every muscle in her body is engaged. And last one, nice deep breath. Inhale, exhale as you come up. Now hold it right there. Straighten out your wrists, arms are stiff as a board. Reach up, exhale up. Good, your head just stays in neutral. Inhale down. We're working these serratus muscles, still trying to stabilize that shoulder girdle. But now we have resistance. Inhale down, keep the arms totally straight. You have no elbow. Blow it out, 3 more. Good, inhale down. Blow it out, reach higher, 1 more time, as high as you can. We're going to go down just as we started. Always bring it back. Then you're going to place one weight on the floor. And that's okay. And then the other. All right, now let me help you, but I want you to use these muscles. Tuck your chin to your chest. Roll yourself back. Walk it up, walk it up, walk it up. All right, if you were alone, I probably would have had you just drop down to the floor, as that's the safest way for you to get out of that, especially because you've already got a compromised back. Now, right where you're at, we're going to do opposite elbow, opposite knee. So what I want you to do is pick a spot and stare at it. Don't take your eyes off of it. That is your focal point. And what you're going to do, I'm going to do it standing, but you'll do it on that ball, is basically raise the one knee and the opposite arm. Don't take your eyes off the focal point. Pull your belly button towards your spine whenever you're ready. For 1 Mississippi, 2 Mississippi, 3 Mississippi, switch. Each time you've got a string pulling your head up to the ceiling, belly button towards your spine. And switch. And you may find that you're more stable, as you can see, on one side versus the other. Good. Go ahead and switch. This is great for core strength. We're going to do one more on each side. Good. And last one. Now, one of the things, go ahead and just both feet on the floor. One of the things that I'm looking for that you may not be aware of is both of her thighs were parallel the entire time. I'm looking to make sure that your leg isn't rotating out while you're doing that exercise. So if you're doing this at home, make sure that your thighs remain parallel the entire time. So we're going to get rid of that ball for a moment, and we are going to watch out for this weight here. We're going to bring this chair over, get this out of the way. All right, you ready for squats now? So we are going to do some large leg movements. Make sure that your feet are shoulder width apart, thighs are parallel at all times, feet are parallel at all times, but you're looking up. So you're going to just hold onto the chair for balance. As you sit into the squat, you want to stick your rear end out, but make sure your feet and knees and thighs, everything's in alignment, and you're looking forward. So chest is out. You'll inhale as you squat, and then as you exhale, leaning, lift your leg up to the side. You're not going to tilt your body too much, but just a little bit, just to allow your leg to come up. Good. Inhale down, and make sure when you're doing this at home that you're not pointing your feet up to the ceiling, that they're going straight forward. Good. Breathing's important. Inhale down, exhale, power it up as you're coming up. Perfect. Let's just do one more. And at home, or as you progress, you can add more of them to work to your level of fatigue. Now from there, we're going to do a compound movement. I'm going to move this out of the way. All right, now we're going to walk and chew gum, but we'll break this into two components here. So the first of which is retracting your shoulders here, and then bringing this across your body. Now the biggest mistakes people make is to bend their arms, which does not work the proper muscle groups, and the other is to arch your back. We don't want to do either of those. So from the side, you're going to retract your shoulders, bring your arms across your body. Also, don't let your head jut out to the front. And then each time, shoulders back. Okay, so we'll have you try that first, but then we're going to couple it with plies. Make sure your legs are turned out, your knees are over your ankles, and simultaneously, first you will do your shoulders, then everything goes down, or one thing goes out, one thing goes down. Okay, pulling your belly button towards your spine. Belly button in, shoulders back, pull it across your body. Good. Just about even with your zipper there. There you go. All right, open up those legs, turn your feet out, turn them out a little bit. There you go. Now everything, shoulders back, take it down. Perfect. And when you're doing them, you want to make sure that your knees are always over the ankles. Stick your butt out a little bit so you don't feel like you're arching your back as you're going down. Perfect. And just breathe in and out. Let's try 3 more. Retract those shoulder blades. This is a great shoulder stabilizer for anybody who has round shoulder syndrome, winged scapula, and even better, last one, if you've had a lat flap, this will help get those smaller stabilizing muscles of the shoulder girdle rather than the larger muscles that we use in a lat pull down or a row. How's that feel? Yeah. Feel like those muscles are kind of coming to life? Mm-hmm. Okay, hang tight. Let me get these discs here. Now these, they also, I mean, you can get all of this stuff at sporting goods stores now everywhere, and they vary in price. You are going to pay for the quality, so it's up to you. You can get something really cheap or you can pay a little more. It's going to last longer. The great thing about these is you're working on balance and you're working on core, which most of us can use, and particularly when I'm dealing with people who are aging, not referring to you, they have a greater tendency to lose their balance. They have weakened bones. Because they're at greater risk for osteoporosis as they age. And so this helps to strengthen all of the ligaments and tendons in the ankles in addition. So if you do lose your balance, you're not as likely to hurt yourself. One of the long-term side effects of chemotherapy is osteoporosis. And then that is coupled with the fact that a lot of women are on hormonal therapy, which puts them in menopause, so you stop producing estrogen, which increases your risk of osteoporosis even further. So it's really important that people do strength training, weight-bearing exercises when they are in that group. So we're going to start off. The best thing you can do is look down first, place one foot right in the center of the discs, and then pick a focal point and look straight ahead and step up, keeping your knees slightly bent. Now for some people, just standing on here alone is going to be a huge challenge. And you don't want to stand rigid, as you'll be more likely to fall over. So the knees are bent, belly button towards the spine. So see if you can stand on these first. That's your first task. Then what we're going to do is we're going to squat. And to keep you from falling over, you're going to sit back and your arms are going to go out, and then they come in as you come up. Really important, as I keep saying, that the thighs remain parallel, that the feet go forward. Everything is in alignment. And I'm just looking straight ahead. Now, if I want to take this a step further, I can really work on my range of motion and go up. But you notice as soon as I go up higher, I start to get a little shakier. So it's tough. When you're coming off, just step back. And it's always better to just kind of let yourself step off if you feel like you're losing your balance. Because if you really try and save yourself, you're more likely to twist your ankle. All right, so let's switch positions. One foot right there in the center. Good. And if you're doing this at home, just do it next to a wall or even in a corner to give you some stability. So you just see if you can get your balance to begin with. And if you can't do more, that's fine. I've already demonstrated the other. But bend your knees a little bit. Good, just bend a little. And then as you come up, bring your hands to your thighs. Perfect. Inhale as you go down, looking straight ahead, making sure those feet and knees, everything's going forward. Can I get you to hold yourself there for a minute without, not even a minute, like 10 seconds? No. Just relax. Don't go anywhere. All right, we're going to add some weights now. So now we're adding resistance. So your arms are going to go straight out as you sit back. Keep your wrists stiff as a board. Inhale as you come up. Very good. Take it down. Good job. So now we're working on increasing bone density. We're working on core. We're working on balance. Heart rate's probably going up. Okay, now obviously I kept you from falling off there, but you would have just stepped back. Let's do two more. And last one. Now carefully step off of there. So I've had you do a couple consecutive exercises with no break. Your heart rate's up, you're getting a little warm, and that's the goal of this next level. Not only are we working upper body, lower body, we're adding weights, resistance, but we're also making it more cardiovascular in nature. Now, just to reiterate some of the things that I've mentioned throughout the first series and now the second series, is it's really important to start and progress slowly. And you can see that just using 2-pound weights is really a challenge when you go from doing nothing, so to speak, for long periods of time. Then you go to level 1, which is just range of motion and core, and now we are starting to add resistance. So we begin with just a few repetitions with very light weights. Then we can do more repetitions, working up to maybe 10 or 12. Then we go up to the next weight, which would be 3 pounds. Don't skip from 2 to 5 to whatever's next, because if you start to get some swelling in the arm, you won't know at which point it was too much. Whereas if we go to 5s and all of a sudden your arm starts to swell up, it's a pretty safe bet that that was too much, and then you can go back to 2s. But you'll want to see your doctor first to make sure that everything's okay, and you may have to wear a sleeve from now on, a compression sleeve. Also with the bands, the resistance, since it doesn't have a number, the yellow's the lightest, then the green, then the red, then the blue, then the purple, typically. Every brand may do it differently, but you want to start with what they consider very light resistance, then work up to light, and so on and so forth. All right, we are going to do one more exercise standing, then we're going to bring it down to the ground. So I'm just going to give you this chair for balance, and we're just going to do calf raises. Now, if you had stairs at home, you could certainly do them on the edge of the stairs as well, because all we'll be able to do here is actually go up on our toes and go to flat feet. If we were on the edge of the stair, you could actually let your heels drop down and get a really good stretch as well. But just feet shoulder width apart. I want you to exhale as you go up as high as you can on your toes, all the way up. Inhale down, just flat feet. And just your arms are just there for balance, all the way up, all the way down.
And 2 is.
Remember, there's no limitations for you with your lower body, so quite frankly, you could do these till they're screaming at you, but to keep it short and sweet, I'm just going to have you do one more. Perfect. And then we are moving down to the ground for the fun stuff. So before you get too comfortable, I am going to bring in this foam roller, and I'll show you how to do it. Now, you can get these stores as well. You don't have to have all of these little devices in order to do these exercises. So what I'll do is I'll show you how to do this exercise on the foam roller, and then just for those people who may not have one of these, you can do it without it. This, again, is really great for balance and core. What you do is you start off on, I'm just going to kind of scooch to the very end of the foam roller. I don't know how graceful I'm going to be here. Now, if you've had an abdominal tram, this is going to be one of the best exercises you can do, but it's going to be challenging getting on and off it. So where I can roll down naturally, the person who has the abdominal tram will probably want to start on the floor, then move themselves up and slowly let themselves come down. So we're both in the same position, only now I'm having to balance on this foam roller. And I can just hold the stretch here too and get a fantastic stretch, but I'm going to do this just to stabilize myself. And I'm looking, and my feet are shoulder width apart, my legs are shoulder width apart. And let me just go through the whole thing and then we'll have you do it. So my belly button's pulling towards my spine, and I'm going to just tiptoe. Now while I'm doing this, I'm pulling my belly button in, so I'm engaging all of my abdominal muscles. The further away, so I start to walk my feet away from my body, just like when you were doing the bug on its back, the further away your feet go from your body, the more of a challenge it is. I have to really engage my